Falling out of the crib. Part 1. Charlie lives with his mother after the divorce and is 19 years old. He is a small man 5 feet 2 inches tall, weighing only 80 pounds. Charlie has long brown hair and could pass for a girl since he is feminine. Charlie don't like people saying he looks like a female. He thinks of himself as rough and rugged. Mother goes along with that to keep him happy. Mother Doris is 38 years old and got the house and half the savings after the divorce. She is well off but is wondering when Charlie is going to find a job. She knows this is difficult for a small man, but he needs to try harder. Doris is happy with long blonde hair and normal build for 6 foot tall and 180 pounds. Charlie takes after his dad, who was a small man. Things are going good at home except for Charlie's lack of effort to find a job. Doris lectures him on this and he says he can't find anything for someone small like he is. Mother knows this is just an excuse for being too lazy and enjoying life at home. Today is Monday, the 1st of June in the year 1995. Charlie and Mom live in the same 3-bedroom house Charlie grew up in. Charlie has his own room with a color TV and stereo. Mom is lecturing him on making more effort to find employment and earn his own income. Charlie still gets an allowance and lives at home for free. "I hope you apply for more jobs, dear," Mother said. "A small man has to work like anyone else." "Yes, Mom, I put in a few applications last week and no one hired me," Charlie said. "I applied by mail since I don't have a car." "You know I am available to provide transportation, Charlie," Mother replied. "I was not asked to take you anywhere." "Okay, Mother, tomorrow is another day. I will try harder," Charlie said. That conversation ended and the rest of the day was pleasant for Charlie and his mother. That night Charlie went to bed after midnight, which annoyed Mother. He should be getting up early every day. To everyone's surprise, there is a loud noise around 4 a.m. Charlie fell out of bed like when he was a small boy. Doris came to his room to find him on the floor with his wind knocked out. "Charlie! Charlie! Wake up, sweetie," Mother exclaimed. "You must have been knocked out when you fell out of bed." Doris is scared but notices Charlie is catching his breath again and he responds that he rolled over and hit the floor hard. Charlie is helped up and appears to be fine but shaken up. He is helped back into bed. "I don't know why you suddenly fall out of bed like when you were a child," Mother said. "I am glad you appear to be all right. I will have to have the doctor see you tomorrow." "I don't think that is necessary, Mother, but I will go if you insist," Charlie said, rolling over and closing his eyes. Doris said good night and it is very late when she goes back to bed. Doris will take Charlie to the pediatrician since he still uses Dr. Cindy Brown as an adult. Mother falls back to sleep until 8 a.m. arrives. She makes a call to the pediatrician. "My son fell out of bed at 4 a.m. this morning and I would like him checked by the doctor," Doris said to the nurse. "Sure, come right in and Dr. Brown can see him right away," the nurse said. "I hope nothing serious is wrong." Doris is glad to hear this and goes to get Charlie out of bed. He is helped to get dressed, being a bit stiff and sore from the fall. Mom is worried and helps Charlie to the car. They arrive at the doctor's office at 9 a.m. "Have a seat, Doris, and little Charlie can be seen in a few minutes," Nurse Dolene said. "Charlie will be the first patient of the day." Mother and Charlie have a seat in the waiting room. They are called back to an exam room by the nurse within a few minutes. Charlie sits on the exam table waiting to be seen. Dr. Cindy Brown walks in smiling and greets Charlie and Doris. "I think you are too old to be falling out of bed, Charlie," Dr. Brown said, looking more serious. "I hope you were not hurt badly." Charlie is already undressed, wearing his exam gown and briefs. Dr. Brown removes the gown to look Charlie over. He is noticeably stiff and sore when moving around. There does not appear to be any broken bones. Charlie is bruised from falling on his back and has some sprain injuries. He is allowed to get dressed while Dr. Brown talks to Mom in private out in the hallway. Charlie is young and nothing appears to be broken, Dr. Cindy Brown said, "He is bruised up a bit and has some sprain injuries. I have a suggestion you will like, but I am sure Charlie will not." Dr. Brown explains how dangerous falling out of bed can be and she don't want this happening again. She explains how long ago Charlie slept in a crib longer due to falling out of bed. Even to Doris this idea seems embarrassing for Charlie. She does not care since he could have been hurt much worse. "Thank you for the advice. I would not have thought about Charlie sleeping in a crib at his age," Doris said, smiling. "I will get him one. I am sure Supply has a youth crib for little Charlie." Dr. Brown said, "I will have one delivered and charge your insurance. I recommend Charlie spend a lot of time resting after his injuries. I will send youth diapers for Charlie." Cindy continued, "Let Charlie rest a couple days." Part 2. "Charlie won't like this, but I will explain it is doctor's orders and I agree completely," Doris said, thanking the doctor for her help. A youth crib is not hard to come by for a pediatrician. Dr. Brown calls Supply and has a girl's crib delivered to Doris's house. They need one right away and this one is brand new. The crib is wooden frame which is pink. The thick mattress is covered with yellow sheets. A large pillow has a yellow pillowcase to match. The crib is designed for someone Charlie's size or a bit larger. "Let's go back home, Charlie, and you will need to rest for a few days," Mom said, upsetting Charlie. "Rest for a few days, that sucks," Charlie responded with a frown. Doris won't bother telling him the rest of what will happen. She will get him resting comfortably in bed until the crib arrives. He can sit in a chair and watch his bed be replaced with the crib a large toddler girl would love to have. They arrive home and Charlie is back in pajamas and in bed. Only an hour goes by when a hospital supply truck pulls up outside. Two nice men knock at the door with a delivery. Doris gets Charlie up and out of bed. He sits in a chair as instructed. The men come inside first and take Charlie's single bed to the spare room. "Oh wow. Did you get me a brand new double bed?" asked Charlie. He thought maybe with a double bed he might not roll out of it. That is not an option Mom or the doctor thought of since a fallout is possible. Soon Charlie watches as a pink girl's youth crib is set up in place of his twin bed. Another matching piece of furniture is added. The doctor sent along a youth diaper table. Charlie does not figure out what that is, but he sure don't like the pink crib. "Mother, what is that big crib doing in my room?" asked Charlie. "That is your new bed so you cannot fall out of bed and hurt yourself," Doris explained. Dr. Cindy Brown, your pediatrician, sent it over and insists you sleep in the crib for your own safety. While Mom is talking to Charlie, the men bring in a couple of boxes and lay them on the dresser. Dr. Brown thought of everything and sent over a case of 96 Attends youth diapers with 3 blue tapes. These are very thick diapers with a plastic outside. Dr. Brown included a couple of girls' pink Onuses in Charlie's size. She added a half-dozen pairs of plastic panties, all for a girl Charlie's size. A pink and yellow girl's nightgown are included in one box. A pack of Gerber baby bottles are included. Doris is unaware that all this extra stuff was added to her order. All will be paid for by the insurance, so Doris is quite happy. Before the men left, a large high chair is put in the kitchen. A large playpen is set up in the living room. The high chair is wood frame, the playpen is padded metal frame with cloth sides. Dr. Cindy Brown has given Doris what is needed for babying little Charlie, including diaper, rash cream and baby powder. "Thank you, gentlemen, for everything," Doris said, tipping the men. "This was much more than I expected." Charlie is in his room not happy about this situation and he does not know everything yet. The brown boxes are still on the dresser left unopened. He don't know about the diapers and plastic panties. Mom returns to the bedroom to find Charlie about having a fit. He is too stiff and sore to move quickly. "I don't intend to sleep in this crib," exclaimed Charlie. "I am not a baby or toddler." "You are certainly acting like one," Mother replied. Good thing those boxes contain diapers and plastic baby panties. You can't put me back in diapers at my age, exclaimed Charlie. Charlie is even more shocked when he hears about diapers and plastic baby panties, and they are for him. He sits in the chair while Mother explains that the other piece of new furniture is his diaper changing table. Mother opens the boxes and unloads them on the dresser. A while back Doris went to see Dr. Cindy Brown about Charlie's lack of effort finding a job and his childish behavior. After Charlie's fall, she insisted on the crib and added everything else. She is giving Doris the opportunity to discipline Charlie as a punishment she feels he needs. The doctor said bed rest for a few days, so I will diaper you right away and get you in your crib, Mother said sternly. You can't do this to me, Mother, I am 19 years old, Charlie complained. I am following your doctor's orders and you will obey me as long as you live at home, Doris reminded Charlie. You are not too old to spank over my knee. Being so small, Charlie is afraid his fate is sealed. Mother is much bigger and he knows to obey her. To prove her dominance, Doris picks up Charlie out of his chair and lays him on the diaper table. She has found the Attends diapers, pink plastic panties, and a pink Onacy. Doris has the diaper rash cream and baby powder ready to use. I will put the rest of your things away after I get you diapered and in your crib, Mother insists, pulling off Charlie's pajama top and bottom. Charlie struggles uselessly as Mother pulls off his briefs. He is the size of a small boy at age 19. Charlie is lifted by both ankles to expose his bare bottom as Doris rubs in diaper rash cream. A plastic diaper mat came with the diaper table. The diaper table matches the crib being pink with a mattress covered with a yellow sheet. I am feeling like your mommy again, sweetie, Doris said smiling. Doris rubs in diaper rash cream on Charlie's front diaper area, including his private parts. He has a little hair in that area but not much. Baby power is applied to Charlie's diaper area. He is lifted by the ankles again and an open diaper is slid in place. Stop this immediately, Mother, Charlie insisted, this is ridiculous. Doris pulls the diaper up between little Charlie's legs and tapes it on snugly. The plastic baby panties are put on next, with Doris explaining she wishes to be called mommy again. The pink Onacy is another surprise for Charlie. Mommy sits him up and slips it over his head, putting his arms in the short sleeves. Charlie is laid down to have the pink Onacy fitted and snapped at the crotch. Look at you, sweetie, Mommy said, you are diapered and dressed like a toddler girl and ready to be put in your crib. I can't believe you dressed me like a toddler girl rather than toddler boy, Charlie objected. I suppose it is because of my long hair. No, sweetie, I dressed you this way because your doctor provided the girls' clothing, Mommy explained. She only had a youth girls' crib available immediately. Charlie gave Mommy a new idea. He will get a bath tomorrow after resting for a day. His long brown hair will be fixed like a girl's. His small amount of crotch and bottom hair will be removed with Nair. Charlie has a bit of leg hair that will be taken off with Nair. His face has only a few whiskers and those will have to go too. He shaves once a week since that is all that is needed. You have been injured by falling out of bed and need rest, Mommy said. Sleeping in a crib will keep you safe and I will keep you diapered. Yes, ma'am, since I don't have any choice about this, Charlie replied. Part 3, Mommy lowers the crib side, then picks up little Charlie and lays him in the crib. He is easy to pick up being so small. Mommy raises the crib side until it locks. With both sides raised, the injured boy cannot fall or climb out of his crib. The side rails are 4 foot higher than the mattress. Charlie is only 5 feet 2 inches tall, weighing 80 pounds. You are confined to your crib for a few days other than your diaper changes, Mom said, warning Charlie to cooperate. Yes, ma'am, but after some rest there is no need for diapers, Charlie suggested. I will only be in the crib to sleep and don't wet the bed. You will wear a diaper every night and sleep in your crib with the sides up, Mommy said. I may keep you diapered during the day too. Charlie eventually relaxes after Mom gave him a mild prescription pain pill provided by Dr. Cindy Brown. He ends up taking a nice nap. Mommy Doris enjoys unpacking the rest of what is in the boxes. She removes Charlie's underwear from the top drawer and fills it with stacks of disposable diapers. Doris sees this as an opportunity to punish little Charlie for being lazy and having a bad attitude sitting at home all day. She finds girls' lacy top socks and puts a pair on Charlie. Plastic panties and girls' socks are put in the other top dresser drawer after removing the men's socks. There is room for the diaper rash cream and baby powder. One more pink Onacy is put in the dresser along with the two girls' nightgowns neatly folded. Mommy is packing all of Charlie's clothes in one of the empty boxes. In the second box, more girls' clothes are found. There are a couple of skirts with matching girls' t-shirts, all in Charlie's size. A cute pink sundress is unpacked and hung in the closet. A yellow sundress is put in the closet along with a white slip with petticoat. Charlie is going to be a little girl, not a boy, for a long time. Mommy concludes that with Charlie needing to sleep in the crib with the sides up to prevent falling out of bed, he will be diapered every night. Mommy decides to keep Charlie in day diapers even after he no longer has to rest in the crib for a few days. Doris thinks this is a fitting punishment for Charlie's lack of ambition and sitting home all day. Doris takes the 3-pack of Gerber baby bottles to the kitchen to be washed. She found a 2-pack of Gerber toddler pink pacifiers and washes those too. Mommy returns to the nursery to find Charlie fast asleep. She slips a pacifier in his mouth and begins to suck on it like when he was a baby boy. This is all perfect, Doris thinks, and she will be using the playpen and high chair. Because he fell out of bed and was injured, Charlie's whole life has changed. Much of the extra babying is due to his bad behavior, and this will go on for a long time. Doris calls Dr. Cindy Brown on the telephone to thank her again for her help with little Charlie. Hello, Dr. Brown, I am calling to thank you for the crib, diapers, and everything else you provided, Doris said. I have Charlie diapered, dressed, and resting in his crib. That is wonderful, Doris, Dr. Brown said. I added the extra items since I knew little Charlie needed some discipline. As a diapered toddler girl, he will learn to behave better. He was shocked to see the girls' youth crib and even more shocked to see the diapers and plastic baby panties, Doris said. Thanks for the diaper table. He did not know what it was at first. Charlie chose to be lazy and sit around home all day, Dr. Brown said. Let him do this as a toddler girl. The ladies chatted a little longer before hanging up the phone. Doris assured Dr. Brown that Charlie will remain a toddler girl. She told Dr. Brown about how Charlie's evening bath will go, including his body hair removal. Being a dominant female, Dr. Brown loved that this is taking place. Doris assures her when Charlie comes in for a follow-up visit in a week, he will be a diapered toddler girl named Charlene. After the long phone call, Doris fills a baby bottle with warm baby formula and brings it to Charlie. A few cans were in one of the boxes. Charlie is just waking up and still sucking on his pacifier. Mommy pulls that out and inserts the baby bottle's nipple. This startles Charlie, but he can't speak at the moment. I have fixed you some nourishing warm baby formula to drink, Mommy said. Finish your bottle while I hold it for you. This surprised Charlie, but he instinctively starts sucking on the bottle's nipple and getting formula. 15 minutes go by before little Charlie finishes his bottle. He don't know a stool softener laxative was added to the formula. Charlie already has to pee and wants out of the crib. Use your diaper, sweetie, your doctor said to keep off your feet for a few days, Mommy said with a smile. I will change you later. Mommy leaves the room with the empty bottle after putting the pacifier back in Charlie's mouth. He wiggles around and realizes he is peeing his diaper for the first time in many years. The medication for pain has him drowsy and he drifts back asleep. Little Charlie wakes less than an hour later and he is pooping his diaper. Drowsy or not, this upsets Charlie and he can't believe this is happening. Mommy, Mommy, come and change my diaper, Charlie hollered from the nursery. First I wet and then I woke up messing my diaper. Good baby girl asking to be changed, Mommy replied entering the nursery. your medicine must have relaxed your bowels. I will pick you up and place you on your diaper changing table. Part 4, Charlie has wet and messed his diaper and needs changing. Mommy lowered the crib side and picked up Charlie. She places him on the diaper mat on his changing table. A clean diaper is ready and so are the needed diaper rash cream, baby powder, and baby wipes. First I unsnap your pink onesie and pull it up out of the way, Mommy said. Next I take off your pink plastic panties. Now I untape your wet and messy diaper and dispose of it. Mommy is smiling and content to be changing diapers again. Most of the mess is removed with the diaper. Toilet paper is used to clean up the remaining poop. This will be flushed down the toilet. Baby wipes are used to clean Charlie's diaper area real good. He blushes red-faced at what is happening. The medicine is wearing off and I am pretty sore again, Charlie tells Mommy. I am starting to get hungry for supper. Mommy slips a clean diaper under Charlie's bottom and pulls it up between his legs. She tapes it on snugly and puts the pink plastic panties back on Charlie. His pink onesie is pulled down properly and snapped at the crotch. The diaper change took less than 5 minutes. It is 6 p.m. sweetie and you need some supper, Mom said to Charlie. She picks him up and carries Charlie with his legs around her waist and arms around her neck. Charlie gets another big surprise when he is carried to the kitchen and placed in a large high chair. The food tray is locked in place and a bib tied around Charlie's neck. The bib says baby girl and is white with pink bunnies. Mother, why did you buy me this high chair? Charlie asked, puzzled. Because you are my diapered toddler girl and must eat in a high chair, Doris explained. Call me Mommy please, not Mother. Mommy explains to Charlie that she has ignored his bad behavior and laziness long enough. She explains he is her toddler girl and will remain her toddler girl for a year or longer unless he is very well behaved. He got away with a lot but is being punished for it for a long time. His falling out of bed has led to this embarrassing punishment. Dr. Brown has had a lot to do with his present situation. After a few days of rest you can be out of your crib during the day, Mommy explained. You will remain in diapers both day and night. Doris called the grocery store and had jarred baby food delivered while Charlie rested. She has a whole case of baby formula for Charlie. He is spoon-fed yellow squash and creamed peas by Mommy. When she is finished 4 of the little jars are empty. A baby bottle is filled with warm formula and given to Charlie after Mommy puts a pain pill in his mouth. Drink up and swallow your pain medication, Mommy said. Soon you will be back in your crib with the sides up for safety. You will not be falling out of bed and getting hurt again. After drinking his bottle, Charlie is finished with dinner. He is given a second baby bottle of cold water to drink. Charlie is carried to his crib and put down so Mommy can raise the side rail until it locks. He must drink plenty of water like usual to stay hydrated. A pink teddy bear is placed next to Charlie and he hugs the bear drinking his bottle. It will likely be more than a year before I even think of potty training you again, Mommy said, disappointing Charlie. After your morning bath and feminization I will start calling you baby Charlene. Mommy explains to Charlie that he has a follow-up visit with Dr. Cindy Brown in a week. He will be taken there as a toddler girl called baby Charlene in a diaper and dress. His new age is considered to be 5 even if he is a bit bigger than a 5-year-old. His size is that of a 7-year-old. You are not bigger than a 7-year-old little girl, Mommy said, smiling. I will consider you to be age 5 and still a diaper-dependent toddler girl. Mommy, I don't wet or have accidents, so why do I need diapers all the time? Charlie asked. I will need them if you keep me in diapers. Yes honey, soon you will be diaper dependent and I will be changing you every day like a baby or toddler, Mommy continued. No need to fight this, sweetie, since you have no choice but to obey Mommy. I guess I should have found a job long ago, Charlie concluded. You are punishing me for being lazy and sitting home all day. Yes sweetie, your falling out of bed and needing a crib made me realize you are not mature at all for age 19, Mommy lectured. I have decided to punish you with the help of your pediatrician. After the long talk, Charlie becomes drowsy again from his medication. He hugs the bear and falls back asleep knowing what the future is going to be like. Mommy goes to the kitchen and fixes supper for herself. She takes a warm bubble bath and puts on her pajamas early. "It is 9 p.m. little Charlie, and I think you may need changing again," Mommy said entering the nursery. "You are in your crib for the night after I change you." "Yes, Mommy, I peed again while sleeping," Charlie said, surprised by this. "I could not feel it happen and woke up wet." Charlie is diaper changed on the changing table again. This time Mommy dresses him in a very cute pink nylon girl's nightgown. The nightgown is short and well above Charlie's knees. It is a little girl's nightgown but fits Charlie. The nightgown has short puffy sleeves with white lace. The high rounded neck has white lace and so does the hemline. Plastic rubber panties are put on Charlie that match. Part 5. After a good night's sleep in the crib, Charlie is feeling a little better as far as aches and pains. He woke up a couple of times during the night thinking he can get out of bed. Charlie then remembered he is locked in a crib for his own safety. Charlie is wet this morning and messy too. His diaper needs changing. "Good morning, Charlie. I have fixed a warm bubble bath for you," Mom said. "This will help your aches and pains, so just relax, sweetie." Charlie is allowed out of his crib wearing a diaper, pink rubber panties, and a girl's pink nightgown. Mommy undresses Charlie, including taking off his wet and messy diaper. Charlie is cleaned with toilet paper and baby wipes and taken naked to the bathroom. "Stand still on the bath mat for a few minutes," Mommy said. "I have a cream to rub on your legs." Mommy takes Nair permanent hair remover and rubs it all over both of Charlie's legs and thighs. He has very little leg hair, but it will be gone. Mommy goes up further and rubs the cream all over Charlie's bottom. She rubs it all around on his crotch and private parts. That small amount of hair will be gone too. Charlie has no hair on his arms, chest, or stomach. He has a bit of peach fuzz to be removed on his face. "Your whiskers have not grown much for a 19-year-old, Mommy said. "Stand still while I rub this on your face." Charlie is starting to figure out this is Mommy's hair remover. He becomes upset knowing what the result will be. Mommy has Charlie stand still for 5 minutes as the hair and roots dissolve. "Okay, baby girl, you can soak in the tub for a minute," Mommy said. "I will wash you with soap and a washcloth and all your hair will be gone." "I did not want you to remove my body hair, Mommy," Charlie objected. "Relax, sweetie, you did not have much hair anyway and now you will be very feminine like a little girl," Mommy said. "I know that and did not want to be more feminine," Charlie explained. Mommy soaps up a wet washcloth and has Charlie stand in the tub. She rubs the little man with soap from head to toe. His small amount of body hair washes away completely. Charlie sits again and closes his eyes as the Nair is washed from his face. Mother rinses Charlie off, wiping him again with the washcloth without any soap. His hair is washed with baby shampoo and rinsed with clean water from a cup. "You will smell pretty too from the flowery bubble bath," Mommy said, getting Charlie out of the tub. She takes a fluffy clean white towel and dries Charlie. His long brown hair is combed while wet to get out any tangles. Charlie looks in the mirror and sees his feminine body. Mommy loves the results of her bath and hair removal. "You made me just like a little girl without body hair," Charlie said. "Yes, Charlene, no one will be able to figure out you are really a boy anymore," Mommy said, "unless they end up changing your diaper." Charlie don't like that name but is stuck with it. He is taken back to the nursery and put on the diaper table. Charlie is feeling a bit better this morning but still in some pain. Mommy applies diaper rash cream and uses baby powder to prepare Charlene for her diaper. A clean diaper is spread open and placed under Charlene's bottom. Mommy just lifts her by the ankles and slips the diaper in place. "You will spend today in your crib resting," Mommy said, pulling the diaper up between Charlene's legs and taping it on tightly. "I am not tired but do feel a little sore from the fall," Charlie admitted. Charlene is dressed in a clean pair of pink plastic panties. Her pink nightgown is clean and put back on for in the crib. Charlene sits so Mommy can blow dry her hair and brush it. A ponytail is put on each side of Charlene's head and tied with a small pink ribbon. This makes Charlene embarrassed even more. She is dressed in pink lacy top girl's socks and is ready for bed. Mommy places Charlene in her crib and raises up the side rail. Little Charlie is quite embarrassed about being little Charlene. He thinks about how this treatment is going to last for at least a year. Mommy brings a warm bottle of formula for Charlene and pain medication. Open up for your pill and then drink this, baby, Mommy said. This is your breakfast and then you can rest. I am not tired, but I guess I will be when the medicine hits me, Charlene said after swallowing her pill with warm formula. Relax and get some sleep. I will check on you later, Mommy said. Doris goes to the kitchen and makes coffee and pancakes with butter. She is pleased to be treating Charlie this way since he deserves it for being lazy and not working for so long. Doris imagines how cute little Charlene will be in a dress. House cleaning chores are done by Doris until she checks on Charlene at noon. Charlene is sleeping and wearing a wet diaper. Mommy wakes her for a diaper change and some lunch. Wake up, sleepyhead, you need a diaper change and some lunch, Mommy said, getting Charlene up. Charlene is carried from her crib to the diaper table and placed on the changing mat. The nightgown is lifted up and her plastic panties taken off. A wet diaper is untaped and thrown away. Charlene is cleaned up, diaper rash cream is used, and baby powder applied before putting on the clean diaper. Mommy tapes it on tight and puts the plastic panties back on. Charlene is stood on her feet and her nightgown falls back in place. Mommy picks her up and carries her to the kitchen. Charlene is placed in her high chair and made ready to eat. Mommy spoon feeds Charlene baby beef stew with stewed prunes. The prunes were yucky but the beef stew was edible. Charlie, as Charlene does not like baby food.